Tell me what are the things that you need. You just tell me and leave it up to me.
My job as the director of the center is to ensure that everybody's happy and everybody's comfortable with the services that they receive here.
CHN is a family away from home, a home away from home.
My role as the center director is to ensure that, the regular daily operations of the health center, to ensure that we are in compliance with our Joint Commission and our Department of Health standards. I've been working at CHN and Dr. Betty Shabazz Health Center for that matter for the past 3.5 years. I grew up actually 5 minutes away from in the Brownsville section of Brooklyn. It was extremely rough growing up in the neighborhood. However, it's not like it was today. Today, you're dealing with the crack epidemic and you're dealing with a lot of gun violence. Back when I was actually growing up, drugs ran rampant in the community. However, it wasn't that any type of altercation break out, you're actually going to shoot somebody versus fighting them with your hands. When I had an opportunity to pick and choose what health center I wanted to go to, between coming to Dr. Betty Shabazz Health Center here in East New York or the Queens Health Center, I wanted to come to Dr. Betty Shabazz. That was my way of saying, I want to give something back to this community, and being that my grassroots stem from this community, I really wanted to help increase awareness. We treat every patient that comes to our doors like we're family, and to me, like the way I welcome and greet my family, I welcome and greet the patients that come here. I try to increase awareness here in the community, try to be an upstanding citizen in the community, pretty much even be a role model, so to speak. A lot of people are aware of me. Everybody knows who I am, and they see what I've tried to do and what I try to bring to the community. And, by us having various health fairs and things of that nature, it's been kind of good because we're giving like free health screenings to patients. We do a lot of giveaways in times around Thanksgiving and Christmas time. Probably like 45-55% of the people in the community live underneath the poverty level, and around Christmas time can kind of present some challenges there. And the mere fact that I can get to give a kid a toy just so they can have something to open up with, I think it's great. They understand that, we're not just a health center who's just trying to get them in, but we also trying to increase their awareness as well.
I came to the United States at the age of 16. So from the age of 16 until I got diagnosed, I was diagnosed at the age of 23. I'm now 42. So being diagnosed at the age of 23, I'm a young girl. I was in survival mode. So there was a lot of what we tend to call dysfunctional behaviors, but it was behaviors of survival that I was engaging in. I was a severely battered woman because I was living in a domestic violence situation, and because of those issues that was going on, I was offered HIV testing, and I agreed, and I'm diagnosed, and immediately got into care. Getting services, I'm getting stuff coordinated. I got to do something positive. And it took me into that mode of starting to volunteer. So I would volunteer and go out into the community and started speaking to other women who I saw. I went back to places where I knew I came from and talked to women who were pretty much within similar settings that I were in, just sharing my experiences and informing them about the organization. One of, in fact, our CEO and one of our today, in fact, he's the AVP over our HIV programs, learned of the things that I was doing, and I got called into a meeting, and I was offered a job. Part of my teaching now, to that community and to that population is not what you do, but it's how you go about it now today. And you want to get the best outcome, and you want to get positive outcomes. You get more, I'm teaching my community, you get more with honey than you get with vinegar. Community healthcare network have a tremendous impact, a positive impact in the clients that we continue to serve. I'm a testimony to knowing that need is still out there, and I'm fortunate And it's what I would say, it's the meaningful part of my work.
I found out about Community Healthcare Network approximately 18 years ago when I was thinking of committing suicide after battling with HIV. I remember my first few times in the hospital. It was very uncomfortable. I was treated worse than a dog. The doctor had to, after admitting in the hospital, the doctor was, he encouraged me to take the AIDS test, but I knew I was HIV positive, but I didn't know I had AIDS. But on this day when I came into the hospital and I had PCP pneumonia, he decided to ask me to take the HIV test. So as the doctor opened the door to let me know that I had AIDS, he did not enter the room. He stood by the door and he threw the papers at me with a rage. You have AIDS! Get out! Get out! Get out of the hospital! You have AIDS! Get out! And it shocked me to see my own doctor, who had known me and my kids for so many years, had treated me like that. The night when I found out about CHN, that night it was a very agonizing night. I cried and cried and cried, and I had taken this number about HIV that I saw on the TV, and I got that number and I called them, and I spoke to someone there, and they gave me CHN number. Well, that morning I called them, the Monday morning I called them and I told them what happened, and they said they were starting up a program over here, and they have information about HIV and AIDS. I should come in and get information and get help. They keep on continually telling me to come out, and I wouldn't come out because I came to the doctor, but I wouldn't go to the support group. And eventually I started coming to the support group. I was one of the first. Here are my 18 years and I'm still here. I get a lot of help. This is my home. This is my first home. I'm more comfortable with myself and with others. I'm not embarrassed anymore. I could hold my head up high. So I feel great today. I haven't been sick. You know, every year is better. Every year has been better.